Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing the medication known as Perphenazine. Its brand name is Trilafon. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not used as a source for recommendations for your personal health care. Now, during this presentation, we'll discuss the mechanism of action or how this medication works, indications or reasons we prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Perphenazine. We'll then discuss examples of dosing and finish it off with side effects. I've put together some slides to go over this information, so let's jump right into it. So the first thing to discuss here would be the mechanism of action or how this medication works. So Perphenazine is a piperazonyl phenothiazine that has activity in all levels of the central nervous system, specifically the hypothalamus, although the site and mechanism of action of its therapeutic action is still unknown. In terms of indications or reasons we prescribe this medication to a patient, well, we may see Perphenazine prescribed in the treatment of schizophrenia, as well as the treatment of nausea and vomiting. With respect to contraindications or reasons we would not be able to prescribe Perphenazine, well, first off, we just wouldn't give this medication to a patient who had a hypersensitivity to Perphenazine or any other component of the formulation. This medication should not be used with large doses of other central nervous system depressants. If a patient had liver damage, they would not use this medication. And finally here, if a patient had subcortical brain damage, they would also not use Perphenazine. Now for examples of dosing with Perphenazine. So in the treatment of schizophrenia, for a patient who is moderately disturbed and non-hospitalized, we may see an initial dose of 4 to 8 milligrams orally 3 times daily. For maintenance therapy, we may see 8 to 32 milligrams per day given once or twice daily. For hospitalized patients, we may see 8 to 16 milligrams orally 2 to 4 times daily and a maximum dose of 64 milligrams per day. As with all medications, there are some side effects or adverse reactions that patients may experience while using Perphenazine, so we'll go over some of those here now. Some common side effects may include dizziness, constipation or hypotension or low blood pressure. Some patients may experience orthostatic hypotension, which would be a sudden drop in blood pressure when going from a seated to a standing position. Diminished sweating and photosensitivity are possibilities, as well as xerostomia, akathisia, or dystonia. Some patients may experience somnolence, Parkinsonism, tardive dyskinesia, blurred vision, urinary retention, or nasal congestion. The more serious side effects may include prolonged QT interval, priapism, or thrombocytopenia. Alright everybody, that's all we're going to talk about today with Perphenazine or Trilafon. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, and most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.